I'm joined by Toyah Willcox, who has recently had her bottom lifted. You've got a peach-like bum. Why did you want your bottom lifted? Tell me all about this. I'm very interested.
You've got to laugh about it.
No, it's great.
I was invited to have this brand new procedure by a major paper, and I'm really grateful for it. And
right.
I went along to meet Dr Mike Comins, who has brought the procedure to England, and he looked at me, gave me a consultation. He said I could do so much for you, and I took it as a compliment.
Okay, good. Very positive about these things.
So it started with him giving me vaser high definition liposuction, which is really, really quick.
Right.
Because it's quick, they can work in a larger area. Right. So he said that he could make my legs look longer, so he took my hips down, took my thighs down, and then put macrolane filler into the top of the buttock to lift the buttock up and make my legs look longer. Ooh. Now, would you like me to show you?
Please, I would be delighted.
Okay, and I'm eternally grateful for this, because when you start going through menopause, you get square hips. Right. So he took that away. Right. He took the bulge there away, which we 50-year-olds get, and then he put the filler in there.
Fantastic.
And I'm really very, very
You've
chuffed.
got a pert bottom, but the thing is, you've got a great figure anyway. Would this work for somebody that maybe hasn't got such a great figure, has got a little bit of weight to lose?
Well, I do recommend people lose weight because it's not healthy to have it surgically removed. No, indeed. As you know, I'm on stage the whole time singing and acting, so I'm relatively slim, which made it easier for him to do. Sure. I also noticed that within the last 4 years, because obviously I've had a facelift, and most people know that, and I'm very into what I call maintenance surgery.
It's a good one, though. You wouldn't be saying to you've had work done. You just look good.
Well, I'm not interested in looking younger, because I think 50 is a really interesting time to be living, but I do believe in looking well. Sure. And my bum had started to go flat, and I'm in a show called Vampires Rock where I wear nothing but PVC cat suits. Wow. And when I was offered this...
look at you there.
It's very camp.
Toyah, that's brilliant. Look at your figure.
We're in Belfast this Friday at the waterside, and
I bet you that's great fun.
It's fantastic fun, but believe me, it's even better now because those cat suits look fantastic. Yeah. And for the first day when I had it done, I wasn't able to sit down. In fact, I couldn't sit down for 2 days, and I was supposed to have 2 weeks off, and I just can't do that. I went straight into doing concerts. But I was also called to an executive meeting at ITV where I couldn't sit down, and I actually did the whole meeting kneeling at the table, and they just thought I was completely mad. It's okay, it's Toyah Willcox. She's crazy.
She's slightly eccentric.
Slightly eccentric. So I did the whole thing sitting down, and then someone said, would you like to sit? And I said, no, I can't.
Because you were kneeling. Did you tell them why?
Yeah.
Oh, that's okay then.
Oh, yeah, they just laughed their heads off. But for the first 2 weeks, you're in a corset, which starts there and finishes up there. Okay. And you actually physically can't sit down. Because it has to keep the shape and everything.
I'm with you. So this is not for women who want to have thinner, hips and thighs. This is if you're okay. It's more about sort of getting back to what you were maybe 10 years ago.
It's getting back to what you were. It's relatively inexpensive. The macrolane starts at around £1,500. Okay. Lasts for about 3 years. You have a top up.
Oh, really? Right. Okay.
And the high definition vaser, which was surprisingly unpainful, lasts forever.
Oh, really?
I won't put weight on in that area again. And that starts at £2,000.
But that's forever and ever and ever.
Ever and ever.
Of course, you've got to be careful because you're not the kind of person that would put weight on anyway. But, I mean, you have to be careful about that.
The biggest temptation is you think, wow, I can go and eat. Yes. And then ever since, I've had to stop myself buying sweets and everything because this has been magically removed so easily. And you think, oh, well, it can't go back. I will just put 500 calories in. But just come back to somebody else, wouldn't it?
Just comes back elsewhere. That's not what you want. So how long did it take for you to be back and all fine and being able to sit down and, back to normal? I sat down for the first time after 2 days and thought, no, I'm not going to do that for a while. I had a complete week off. Right. Lying on my stomach when I went to sleep. Okay. Not good for the face, I can tell you that. I woke up completely creased. But then I had to start driving to shows a week later, and I put a cushion in the car. It was a little bit painful. A little wee bit, yeah. And they say for 6 weeks you feel a little bit achy, but nothing that a paracetamol can't get rid of. Okay. So it's not, it's not absolutely terribly difficult to
Not
bear?
terribly difficult, but I do work with men that like to smack bottoms.
Oy.
And on my first show back at Vampires, I said, if you touch my bottom,
you'll be a happy woman at all.
You know, you really don't want that at all.
Absolutely not. So for anybody out there that just wants a little bit of a help, a little bit of literally a lift, you know, then this would be a good thing to do.
It's called non-invasive.
Yeah, I like that term.
Yeah, so it's safe.
Yeah, for sure. Listen, good luck with the show.
Thank you.
Vampires and PVC.
Vampires rock.
Vampires rock.
A great thing to be doing at my age.
More power to you. More power to you. Honestly, I would mean at least 20 years younger. Thank you so much, Toyah. It's great to see you.